The idea is that your earliest love relationship is with the people who raised you. Usually your parents, but not always. And that's where you develop, if you will, kind of a schema for how relationships work. So EFT considers what you bring into the relationship from that history, right? As well as what happens between you and your partner. And the idea is that often the two models that you bring in of attachment cause some kind of block to intimacy.
Hello and welcome to another episode of the Hope Strategy Podcast. We are thrilled with the conversation that we just had with Dr. Laura Craig-Bray. And Josh, why don't you read us the bio so we can learn a little bit more about Dr. Laura?
Dr. Laura Craig-Bray, she's a graduate of Clark University. She's been licensed as a clinical psychologist since 1995. She's taught at the college level. She directed a college counseling center. She worked in public schools. Most of what we talked about on the episode today was around emotion-focused therapy, which we both kept struggling to get right. We kept saying emotional-focused therapy, emotionally focused therapy, but it's emotion-focused therapy, or EFT, which was created by a woman named Sue Johnson, who we reference in the podcast a few times as well. And Sue Johnson has some books out called Love Sense and Hold Me Tight, and another one called Created for Connection that was co-authored with somebody else. But Sue Johnson created this therapy framework, I guess you could call it, EFT. And so we talked about how this is giving couples and families and people hope for their relationships. And I was super excited to talk to Dr. Craig-Bray because I listened to her on another podcast and she was describing this person that she called a withdrawer. And the more I listened to it, the more I thought, this is me. This is exactly me. And this is how I am in all my relationships. And this explains all my problems. So that's part of why I was excited to talk to her personally. But I think this was just such a great episode for anybody in a relationship or even not in a relationship. I mean, not necessarily like a husband-wife relationship, but this is just such important stuff for all the relationships that we have with people.
Yeah, it's great to talk with a PhD in psychology who has dedicated so much time and energy and effort into becoming an expert on, a subject matter, in this case, EFT. And we kept getting it wrong. When I searched it, it said emotional. When I did my research, it said emotional. So every time I brought it up, I kept wanting to say emotional, but then it messed with my head. So I think I butchered it like 4 different times. But yeah, that was great. It really turned into, it's a pretty personal episode. I mean, you went into a lot of detail on the therapy that you and your wife are in, and the way that this has benefited your lives and the way that it's given you so many aha moments as an individual in all of your relationships, but especially with your wife. So that was pretty awesome. And it was funny. It kind of detailed out our working relationship as well a little bit as I heard about it.
Yeah, I was listening to it. I was thinking somebody needs to go out and start EFT for business partners. Like there should be therapy for business partners to come with, because it really is. This stuff impacts every single relationship you have. And it is hard for me to mention, especially in a public forum like this, like say my wife and I are going to therapy, like marriage therapy, because the stereotype or the stigma around that is, oh, you're going to therapy? Well, you must be having like really serious problems. Are you about to get divorced or something? It's like, no, it's like one of my friends 20 years ago, he said this thing that's always stuck in my head. He was going to a therapist at the time and he said, therapy's great. Everybody should have a therapist. It's like the best thing ever. And that always stuck with me. And for years, I thought, maybe that would be kind of fun to just go talk to somebody about how my brain works and everything. And when I finally went to a therapist almost 20 years after that, it was fun. And it was like so helpful to just have somebody say, oh, you know what? You might be thinking this way because of this or this thing. And I was like, you know what? I think you're right. Like, I got to look into that more. But EFT has really taken it over the top for me. It's just been so helpful and it's so positive. It's not about blame. It's not about guilt or whose fault is it. It is. It's all about you, how you think, but how much you care about that relationship. And so I kind of feel like I'm on a mission to get rid of that stigma and say, hey, everybody should be going to this therapy. Like, it doesn't matter. You might think you have no problems. You should go to this anyway, because you'll learn stuff that's great and is going to help you in your marriage relationship, but in every other relationship too.
Of all the episodes we've done, I think this is one that gives you some real tangible information and, tools and resources, and, to really implement it immediately into whatever relationships you've got, and to see a big difference. So I think it'll be really helpful. Everybody's got, we said, we talked about how it can be marriage relationships, but also relationships with your children, or relationships with a friend, or, everybody's got relationships. And Dr. Laura Craig-Bray really enlightened us on this whole EFT world and how it works. And I'm excited for everybody to hear it. So please enjoy this episode of the Hope Strategy Podcast with Dr. Laura Craig-Bray.
Something is happening in our world.
Time is very precious. I'm going to show you how great I am.
Hope in the face of difficulty.
More than machinery, we need humanity.
Hope in the face of uncertainty.
I'm better now than I was. I'm experienced now.
Changing the world can happen anywhere, and anyone can do it.
The audacity of hope.
This is the Hope Strategy Podcast with Corey Blake and Josh Steinley.
There we go.
There it is. Nice to meet you, Laura.
Nice to meet you guys.
Well, let's see. I'm just a few miles away from you, Laura. Looks like it's cold and gray outside.
It's pretty cold and gray, yeah. Intermittent teeny flakes today. I hear we're going to get a bunch on Wednesday night.
Yeah, my kids are excited for that. They're excited for the snow, and I can say I'm a little bit less excited, but I'm excited for them.
Josh, are you recording?
I'm recording too. Yeah, we're double
cool.
recording this just to make sure.
In case there's a failure of some sort.
Yes, we've learned not to rely too heavily on Zoom. I know that with EFT, we talk a lot about connection, and when it comes to Zoom, our connection is unstable very frequently. So, Laura, I'm super excited to talk to you today personally. I've been telling Corey about EFT and everything. I read Love Sense a few years ago. It's probably just like 2 years ago. I read Love Sense. Somebody recommended it to me. I'd never heard of Sue Johnson. And that kind of sent me down this rabbit hole reading all of her stuff. And then my wife and I started visiting with a therapist here in Massachusetts who specializes in EFT. And I just have absolutely fallen in love with EFT. So that's part of why I'm excited to talk to you. The other part is because I heard your podcast recording with, let's see, was it Therapists Uncensored or Unleashed, or I can't remember.
It used to be on the couch.
I was going to say they were on a couch. I know that much.
Yeah, and they changed it to That Relationship Show.
Oh, yeah, That Relationship
Last January, I think it was.
Yeah, so I heard that, and I told Corey, our co-host here. So Corey and I are business partners. We run a marketing agency called MWI. And before I get back here to what I was talking about, the background for the show is that at the beginning of this year, 2020, when COVID hit, and everybody was so discouraged, people were losing their jobs, our business got hit pretty hard. And we were thinking about this marketing agency we had run for the past 20 years and thinking, gee, like this is fun helping businesses with their marketing, but is there something more that we can do? Because just helping people with marketing, we were just looking for something more fulfilling. And we thought, what can we do to inspire more hope? Because there's so much discouragement in the world. And so we thought, well, what if we started working with companies that inspire hope and help people to have more hope? And as a first step towards that, we launched this podcast called the Hope Strategy Podcast, to talk about how hope is the key to everything we do, whether it's in business or our personal lives. But hope is the foundation that leads to action, that leads to the positive results that we all want to see in our lives. So that's why we started this show. And now we're interviewing people that we can find who have great stories about hope or who understand the psychology of hope like you do. Yeah.
Well, I think to be a therapist, you have to have hope, because people come in and often don't, there must be some seed of hope that brings them in, or else somebody's forced them in. But a lot of people are so despondent, don't think that they can do anything to change their lives. And I've seen people change. I've seen people grow and live lives that are much more rewarding and fulfilling. So, sometimes I carry the hope for them.
Mm-hmm. I've noticed that with the therapists that we've been talking to. Well, I have so many questions to ask, but before we get ahead of ourselves, maybe to introduce things, can you tell us a little bit about your background and your backstory and how you got interested in therapy and then EFT?
I'll go way back and say I'm from Louisiana originally. I grew up in North Louisiana, went to LSU.
I was going to say, that doesn't sound like a Boston accent. I'm getting a little bit of an accent. Doesn't sound like Boston.
It does to my family at home. They think I sound just like somebody up here, but up here they can tell it's not quite authentically New England. So I got married, and my husband wanted to be in forestry. So we moved out to Utah, to Logan, Utah, so he could go to graduate school in forestry. And while I was there, my undergraduate degree was in Spanish, mostly because I had no clue what I was going to do with my life. I had gone to Mexico this summer before I went to college, and I had done well in Spanish, so I just kept majoring and taking Spanish until it was time to leave, and I still hadn't figured out anything else. But what that led me to is I worked on a project with a history professor doing oral histories there were a lot of Mexican migrants who settled in Utah, and kind of tracing their history. And then that led me to a job actually working with, in a federal program called Upward Bound, working with high school students who were of mostly Mexican descent. And that got me into working with kids and people. And so from there, I decided to get a degree I got a master's in school psychology and counseling psychology.
Both Corey and I have ties to Utah. That's a bit of a culture shock to go from Louisiana to Utah, isn't it?
It is. Well, it's a geographical shock. I don't know if you've ever been to Louisiana, but it's very flat and very green. And you move to Utah, and it is neither of those things, right?
Especially up in Logan, up there.
But Logan is so beautiful. What had happened to me is one summer in college, I had gone and worked in Jackson Hole, Wyoming, as a maid in the Grand Teton Lodge for the Grand Teton Lodge Company. And I flew into Jackson Hole, and it was socked in, and you couldn't see anything. And so I went, found my place and everything. Got up the next morning, and it was crystal clear, and just like saw the Tetons there, and just truly incredible. Just took my breath away. And I really fell in love with, hiking and camping and just doing all that kind of stuff. So I spent 2 summers there while I was in college. So when my husband wanted to be in the Forestry Service and said, we're going to go to Logan, Utah, that, was very appealing to me. And we were there off and on for 7 years. He got his master's in forestry degree. Then we both went back to school because he ended up computer programming more than being out in the forest, working with forest management. He got a job with Weyerhaeuser. We moved to Seattle area, south of Seattle. And then we both went back to Logan again, and I got my master's in counseling and school psych, and he got a master's in computer science. From there, we came here to North Andover, Mass.
Why Massachusetts?
Well, I wanted a doctorate. And so we looked at places that had multiple doctorate programs. So he looked at IBM in Minnesota and down in New Jersey. There were some places, and here there were 4 doctoral programs that I could apply to. So I figured surely I would get into one of them, right? So we came here, and I applied. I worked for a year and applied, and then got into Clark University in Worcester. That's where I got my doctorate. It has a big developmental emphasis, but I'm a clinical psychologist. And after I got my degree, I taught at Merrimack College for a few years, taught the child clinical program. And then I left there and was director of counseling services at Bradford College until they closed. I don't know if you'd ever heard of Bradford College. But,
I haven't myself.
It was 197 years old and went belly up for fiscal reasons. Anyway, after that, I started working in the public schools, And then I started doing private practice. And basically so I had trained a long time ago to do family therapy. And the way it worked is if you take a course in family therapy and you would learn all these different approaches to family therapy. I'd done a placement where we did different kinds of family therapy. So I was doing the private practice as well as working in the schools and started seeing couples.
Your private practice initially, was that with children? Because you spent the 14 years in the school system. So was that kids or was it?
It was some kids. I've always kind of been a generalist, even though, basically I've worked with kids from preschool all the way up through college, if you think of it that way. And then I've done a lot of adult work because I did my internship at the VA hospital in Boston, the outpatient clinic. When I started the private work, it was adults and children and couples. And the couples I was frustrated in terms of the work that I was doing. I didn't feel like I was getting the traction I wanted with couples. And I went to a continuing education workshop put on by Mass Psychological Association. And it was on EFT. It was just a, one day, 6-hour presentation, kind of like a taste of EFT. And it really appealed to me because of I did a lot of work at Merrimack with developmental psychopathology in terms of attachment and how attachment goes awry and how children end up with different kinds of problems, if you will. So the whole attachment model and the developmental piece and everything was something I was really familiar with. And when they started talking about EFT, it just, rang a bell for me.
So it's
Emotion-focused therapy.
Emotion-focused therapy. I know people are already wondering as they're listening, why they keep saying EFT? What is
EFT?
Okay.
Yeah.
Did Sue Johnson invent EFT, or was it something that she took and just made better known?
So Sue Johnson, I don't know all the history, but she was working with, she's an academician. She was, I think she's retired now in Toronto. So she was working with somebody else whose name escapes me right this minute. And they were looking at attachment and the importance of attachment. And then I think she and that person kind of went in slightly different directions, and Sue really developed the model, I think, pretty rigorously, really using a research framework. And that's one of the things that I really appreciate about EFT is its empirical nature. She's got a lot of research that shows EFT works, that shows different components and why they work. And, in this day and age, I will only, every year I have to do additional training to keep my license. And I will only do training in things that are empirically shown to be valid, because why would I want to throw my money away on other things? So this is about, 7-8 years ago now that I did that. And since then, I've just been on a mission, taking as much EFT as I can. I did a reading study group with some people in Arlington, and then I went to the major trainings that you have to go to for EFT. There are 2 major ones. And I did those. And then I do a lot of specialty trainings. And then along with some people that I met, we developed, originated Seacoast EFT, which is a group to kind of further EFT in the area. We have peer supervision and we bring in speakers and, just do all kinds of things in that regard.
So walk us through emotionally focused therapy, kind of, big picture, 20,000 foot view for anybody that's listening that isn't as familiar. I know Josh is super familiar. I'm not as much. I've done a little bit of research, but.
So EFT is based on attachment. The idea is that your earliest love relationship is with the people who raised you, usually your parents, but not always. And that's where you develop, if you will, kind of a schema for how relationships work. So EFT considers what you bring into the relationship from that history, right? As well as what happens between you and your partner. And the idea is that often the two models that you bring in of attachment cause some kind of block to intimacy. Or maybe things worked really well for a while. I see a couple who feel like, early in their marriage, they were really connected and things were really good. And then they hit a series of roadblocks, the kinds of things that you don't plan for, and that just got them way out of sync. It's called an intrapsychic as well as an interpersonal theory. We look at sort of helping each person maybe make corrections in their model of relationships, as well as help the two of them go together. And, I talk about it like this. So, over here in North Andover, Lawrence and everything, there are people here who still remember before 495 was here, right? And, there's streets that are disconnected. So it's kind of like, what if you were driving around trying to go from North Andover, Lawrence, something Methuen, and, the map you had didn't have 495 on it. And so you'd follow these roads and then you'd have to turn in it, and you could probably get to where you wanted to go, but it wouldn't be nearly as fast and effective as it would be if you had a current map of the territory. And that's kind of the way it is. We live our lives with these unquestioned beliefs about relationships in the world and ourselves that interact with as we try to have relationships with people.
So are there categories for the different attachments or kind of the situation that you're bringing into the relationship? Are there categories like there's five different types or something like that you're looking for when you're doing therapy? Or is it just more, you diagnose it based on every situation is unique? If that makes sense. So
in the old attachment literature, which started with working with children, looking at young children and how they were attached to their parents, there was a secure attachment, an anxious attachment, an avoidant attachment, and a disorganized attachment. What we look at, so the kind of adult versions of that, you can have an adult with a secure attachment. But people tend to be anxious, which we often call pursuers, and avoidant, which we call withdrawers.
That's the word I heard before. I remember right after Josh. So before we knew we were going to talk to you, this is back before when Josh had listened to that podcast. We're business partners, so we talk all the time. But he said something like, "Man, I just listened to this podcast, and as she was talking about withdrawers, which I know Josh has a ton of questions on, we'll get into. He's like, I had never heard somebody like describing me to a T, and how I deal with all of this and how I'm, working a relationship and all that." And I remember him bringing it up. So I love that we're talking now because I was like, I have no idea what you're talking about, but I'm glad you heard it.
Yeah. So, it's important not to get too overly invested. I think with the terms, they're useful to kind of point, kind of like arrows point to certain bits of territory, right? I don't know if there's a number, anybody's got the number, but when people come in, there's a pursuer-withdrawer dynamic that's going on. But I want you to know there can be two withdrawers. Those are hard to work with. You can have a withdrawer and a burned out pursuer, so there are these kind of variations. But basically, the dynamic that can develop between a pursuer and a withdrawer is, and I have to say that a lot of people think of this as kind of a typical male-female, like that they think of the female as being the pursuer and the male as being the withdrawer. But that's not always the case. It's not 100% aligned, although in our culture there's some alignment. But the idea that one partner wants to talk about things, wants to work out wants to work out the problems, wants to, just discuss, come to some kind of agreement, conclusion, just, has a lot of energy toward getting in the other partner's space and interacting around the relationship, right? And they're doing that because they feel anxiety when things are ambiguous or, kind of left unsettled. So they get stirred up. And when they get stirred up, they reach out, and it's kind of like, come on, let's do this. Let's do that. And they pester a little bit. And pursuers can be
raise
gentle.
my hand right now as what sounds like a pursuer.
A pursuer.
I feel like you're describing me and my relationship with my wife.
Right.
Whereas with me and my wife, we definitely fit the stereotype of my wife is the anxious pursuer and I'm the withdrawer. But it's interesting because sometimes it kind of switches. I mean, sometimes I'm the one who wants to really talk everything out, and it's a little bit overwhelming for her. And then other times, the way that she wants to discuss it, it's a little bit overwhelming for me. Although it took us some time to really recognize that this was what was going on, because I wouldn't say I was withdrawing. I'd say, well, I feel judged or I feel attacked. And she would say, well, I'm not withdrawing. I'm just tired because you want to talk at 11 p.m. at night and I'm exhausted. And so, but going through therapy, we've come to realize, we kind of press each other's buttons a lot. And it really does fit into these categories of withdrawer and pursuer. But it took us a little while to recognize that.
So let's run through withdrawer.
Withdrawers. Yeah. So the thing to remember is that neither is bad, and both are doing what they do because the relationship matters to them. So the pursuer is trying to get things all worked out because the relationship's so important to them, and they want to get it all settled so they can feel comfortable and connected again. And so the withdrawer is often overwhelmed by the pursuer's demands to engage. Theoretically, this is all supposed to have to do with attachment, but I think there's a huge piece of kind of temperament that's involved here. So withdrawers pull back because they're overwhelmed by the needs, the demands of the pursuer. They are afraid that things are going to get out of control. Withdrawers tend to feel like they can't really say what they think or feel or mean because they're going to hurt the other one and never be forgiven. They can't, really put it out there. So they want to say it. Somebody's a withdrawer. If you hear them talk about how they're trying to find the perfect way to give this feedback to their partner, right? And they don't want to take that risk of just blurting things out because it's too dangerous.
This is exactly me right here. And my wife comes from a family background. When you talk about temperament, or my wife comes from a family that is more vocal, louder, you might say. And I come from a family that is extremely reserved and conservative in their personality and temperament. I've never heard anybody in my family say a swear word. I've never seen anybody in my family ever lose their temper a single time.
Wow.
Nobody in my family has ever yelled, ever. Like my entire...
That's pretty amazing.
So then when I'm paired up with my wife, who comes from a family where they're very expressive, for me, as a withdrawer, naturally anyway, I mean, I'm kind of quiet and shy anyway. When she gets louder, I'm like, whoa, this is over the top here. And for her, it's like, no, this is just talking. This is communication. And then,
we're just talking. Yeah.
Right. And that's one of the things we have to figure out is like,
there's a couple that I'm sorry. There's a couple I work with, and it's kind of the same for them, that dynamic. And she's just talking. She just does not understand why he's like so scary,
Yeah. And so then when you talk about, you have to find the right way to say things, that's exactly what I've been through. It's like, if I'm going to give feedback, I've got to say it just the right way, the perfect way, because I don't want to cause, a lot of expression or an outburst or something, So I feel like, I have to say it the right way, but then I hold it inside and then it doesn't come out until I'm really emotional about it. And then of course I don't handle things very well.
Laura, so just a little insight. Josh is my business partner. He's also my brother-in-law. And so it's kind of a funny dynamic because he's married to my oldest sister. And so that's why I keep laughing, because I'm hearing him describe our family. And then it's also clicking. Like I haven't really thought about this that much, but I'm like, oh yeah, Josh and I are business partners. And so he's kind of my work wife, and we have a very similar.
You have a marriage, and you're the pursuer. Yeah.
Yeah, that's
exactly.
Funny. I haven't thought about it before.
And I think I said on the podcast you heard me on before, I recognize myself to be sort of instinctively to be a withdrawer, And, I think there's a contribution from my family of origin, but I do think there's also this big temperament piece in terms of when people come at me, I feel like I'm in a wind tunnel. And I've talked a lot with my oldest child, my son, and, he listened to the podcast and he said, "Oh, Mom, that's exactly how I feel." Everything you talked about yourself.
So is your husband a pursuer then?
A soft pursuer. There's a way in which he's, it's not that he's that anxious, but I think when he would complain about something. So one of my funny stories, when we first got married and we were living in Utah, we took turns doing the laundry. Of course, everything was 50-50 until we had kids. And then every week when I did the laundry, he would go, "Oh my God, I can't believe you do the shirts. Like, what have you done to my shirts?" And I would just burst into tears and just like run away. And finally, I don't know how long this went on. Finally, I was able not to run away. And I said, "What is it that I'm doing wrong? It's so terrible." And I wasn't buttoning the top button of his dress shirts. Back then he wore mostly Oxford cloth dress shirts. And I would just hang them on the hanger with the second button and not the first button done. And, afterward, it's just like it really hit me. I couldn't even stay around long enough to figure out what the problem was, because my need to get out of there with his disapproval. He wasn't exactly throwing knives at me or anything, right? Just expressing a little, "Gee, don't you know how to do this?"
And one of the things I love about EFT is that it says that in this type of situation, the reason that you reacted that way is because that relationship meant so much to you. It wasn't that you couldn't handle it or that you didn't want to be around him. It was that relationship meant so much to you that him coming at you in a way that you felt like was an attack really hurt. And this is another thing that my wife and I have learned through EFT, going to a therapist, is that a lot of the ways that we react that we previously looked at each other and said, "Oh, well, they're crazy," or "Why are they doing that?" Our therapist has helped us understand you're reacting this way because this relationship means so much to you and you love each other so much. And I love that positive focus, because that that puts the hope into the therapy of, oh, like, we're not acting this way because we hate each other. We're acting this way because we love each other. And this means so much to us.
Exactly. As somebody who was maybe 6 months married, I didn't want to be disliked or have my husband be angry with me. That was painful. And that's the thing I like about EFT. I love that EFT is not about blame, about who's wrong, but just that because of our history, often we carry into our relationship these barriers to intimacy. And by trying to understand those, trying to understand yourself, make yourself predictable to yourself as well as to your partner, then you can feel safe. When your partner's kind of what looks like blowing up, but to them just feels like I'm just registering that my shirts are funny, right? That doesn't feel safe if you're a withdrawer who's not used to that kind of thing. But once you kind of get it, it's a lot easier.
So obviously you can't share names of people you've worked with us, but can you share some anonymized stories, success stories of people that you've worked with or that you've seen where they came in bad shape, but they left in better shape? What kind of hope is there for couples who might be struggling with some of these issues that they feel like, oh, it's a communication issue, or we're just not matched, or we just don't feel the same way we used to feel about? And then as they go through EFT, what kind of differences have you seen come out of it? So,
I always, couples come in, they say one of two things: we're too much alike or we're too different. And it's like, that really has nothing to do with what the problems are. Everybody who comes in has a theory of what the problem is, and it's usually something they don't know how to impact, how to change in any way. And so, what I usually tell them is my goal, my job is to pull you over to a new theory, a theory that makes change possible, right? That if you begin to understand your relationship using our EFT lens, if you will, then there are places where you can change. Some of the research shows that couples who have any amount of EFT, they don't have to finish. I mean, like EFT is a 3-stage model where the first stage is the longest and then the second, and then at the end you consolidate all the changes. But research has found that any EFT, about 70% of couples report an improvement in their relationship. So that's the empirical piece. So one of the things that makes these barriers to intimacy really complicated is when people have trauma from their childhood, whether it's physical abuse or sexual abuse or, just some kind of loss that they experienced. What you learn when you're a child and these kinds of things happen to you is that it's not safe to love, right? So that a child who loses a parent to death early on, that's like, I was just talking to a client the other day whose father died when she was around 13. And, when that happens to you, it bursts your bubble, right? Your parents are not supposed to die when you're little, when you're young, when you still need them. And so you've got much less trust. And I would say about 90% of the couples I see, one or both partners has experienced trauma. And that makes it just much more complicated and much harder, especially if both are dancing around some pain that they carry. So, what I have seen are these just incredible moments of connection between people that, are part of what made me do this work. I have a couple that I see that both have trauma in their background. They both have extensive substance abuse histories, although they've both been clean for a number of years now. She's the anxious pursuer and he is the withdrawer, and he loves her, but he doesn't think about texting all the time. He doesn't think about reaching out and touching all the time. But because of her history, it's sort of like if he's not contacting her, she thinks she's not important to him. She thinks she doesn't matter. And, we had a session where she really got in touch with where that pain comes from, which was a childhood where that was her mother kind of was not present for her. And, there was nobody there when she was a child and mom was kind of off to comfort her, really. And so when she goes back and she re-experiences that pain, and then he's there to hold her and comfort her and reassure her that she does matter to him. It's really powerful. It's powerful to see, to be there for the experience. And it's a little bit, physiologically, it's healing. When you have this kind of emotional experience, you remember what the pain was, but instead of having to be all alone with it, there's somebody there who's doing what nobody did for you, which is comforting and holding and being there with you.
Now, when you talk about trauma, a parent dying, sexual abuse, like these are obvious forms of trauma. Nobody's going to argue with that and say, oh, no, that didn't affect me. Parents divorcing, things like that. Are there some more or less recognized forms of trauma that people come in with that they don't really recognize, but then you draw it out of them and they say, oh, I never realized I was traumatized by that. But yeah, that makes sense.
Yeah. So there's a form of trauma that we talk about, we talk about traumas with big T's and traumas with little t's. And I think what a lot of people, and this may sound familiar to you, what a lot of people experience growing up is that nobody was there to help them learn about their emotional world or how to talk about their emotional world. I mean, you talk about your family, it was pretty buttoned up. And so we might say that in some ways that's a form of neglect because there was nobody to help you understand your feelings, understand how to talk about your feelings, the role, feelings are okay. And, those kids grow up to be people who often are very uncomfortable with feelings, suppress their own feelings, don't recognize the feelings of others. And so that's a small T trauma that we see an awful lot of it because that's kind of the way child rearing was. I think it's changed somewhat.
Yeah, and I'm laughing because my wife and I actually had a discussion about exactly this topic this morning, and we've been discussing it quite a bit. I mean, I feel like my parents were affectionate, but it's all relative. And when you talk about not being comfortable with feelings and everything, I don't know how much of this was my temperament or upbringing or environment, but yeah, when you say uncomfortable with feelings, that's me. And I'm the one who squashes down my feelings. And I think of myself as very logical and very rational. And I have to work everything out in my head first. But my wife and I have been talking about how, hey, that's great to be able to work things out in your head, but you need to be able to feel and recognize feelings as valid as a form of communication. And it's not that when somebody feels they're out of control, it's that they're feeling things, and we all feel things, and you have to learn how to work with those emotions. Otherwise, if you don't learn how to work with the emotions, they're going to overwhelm you at some point, and then you don't know how to deal with it.
And I think that that's one of the fallacies, all these female pursuers that bring in their husband and say, I think he might be on the spectrum. I think he might have an autism disorder because he doesn't seem to have any feelings. And, it's not, in fact, withdrawers often have very deep feelings. They just don't know what the heck to do with them, how to express them. And, so it's really missing an important piece to assume that these guys often don't have feelings. And, I think in some ways I've come to realize that becoming a psychologist was for me, long before EFT, but it was like the treatment of choice to learn how, because I did have a lot of feelings. By becoming a therapist, what I learned how to deal with feelings, how to manage my feelings, how to be aware of my feelings, how to use my feelings to inform how I think. For me, it was the perfect treatment. I don't think everybody should have to become a PhD psychologist in order to learn these skills that most parents could teach their kids, if they knew it. And that's always the problem, is these things are self-perpetuating. How can you teach somebody something that you don't know?
Yeah. So for somebody like me or other withdrawers out there who, like when you say we have deep feelings, that's how I feel. I feel like I have feelings, but they're very deep, but they are strong. I just tend to keep them tucked away a little bit more than others. What are some of the ways that people can get more in touch with their feelings without that feeling of danger of losing control and feeling like, well, gee, if I get too much in touch with my feelings, who knows what's going to happen? I could lose everything. Everything could blow up.
Yeah. I think that, feelings start in the body. That's where they originate. Something happens physiologically with us. And so I have a small specialty of dealing one of my favorite EFT therapists often sends me the withdrawer in her couple, which often tend to be men. And so they come in and they just don't really know how to do this at all. And I kind of start with, you got to start checking in with your body. What's happening in your body? In your stomach, in your chest, in your heart. Are you sweating? Your face flushing? begin to be curious and notice what's happening. And so I'm also very into mindfulness, being able to take a moment and breathe and just sort of check in with yourself about what's happening. And then it's just like what we do with our children, except we're doing it with ourselves. It's like, oh, wow, I think I'm feeling I'm sweating and all this. I think I'm feeling really anxious. So when we label a feeling, when we kind of say I'm anxious or I'm afraid or I'm kind of angry about that. As a child, I had a terrible temper. My mother would say she was going to cure me of it if it was the last thing she ever did. Unfortunately, she didn't. And I would often be right in the middle of just being so angry about something before I realized I was angry. It just would come on me so fast. So, you sort of tune into your body, you begin to narrate, you begin to label the feelings, you begin to try to establish, relationships. Often we bring on feelings with the thoughts that we have. We have a thought that something that scares us, and we don't even notice the thought until our bodies react and we're having feelings around that. And so it's a process that people have to journey through, if you will, to begin to get more comfortable just even knowing what they're feeling first before they can begin to talk about their feelings. And that's what's, really nice with EFT. My clients, I don't know about your therapist, but my clients are always wanting homework. And I'm like, really, I just want you to notice yourself. And in the beginning, you talk to me, okay? And I try to help them learn to label those feelings and know their bodies and know what they're thinking. And then I try to help them talk to their partner in a way that their partner can hear them, right? And so you get a lot of support in EFT before eventually you begin to be able to talk to each other without somebody there to kind of support everybody in case things go awry.
The most common relationship dynamic, a pursuer and withdrawer, is that?
Yeah, so that's the most common.
Is that, so if you go back to kind of like dating and like finding your partner and everything, is there something to that? I mean, what is it about the personalities of a pursuer and a withdrawer that kind of draws them together and brings them? I mean, obviously those two words seem to make sense, but I mean more detail into why that works.
So, I have this is not EFT. This is just Laura's theory of love, which is that initially what draws you to somebody, it's like interlocking psychopathologies. There's a fit. And I think that for the anxious pursuery person, they look at the withdrawer and see somebody who looks cool, calm, and collected. And they feel reassured by that safety, that security that comes across. And the withdrawer who has so much trouble with their feelings, sees a pursuer who seems, sort of freer and warmer and, has access to the stuff that they don't have, and they kind of bask in the glow of that. And when you meet that person, it's just like, how do you know? I don't know, but And I think part of it's because there's that fit, your needs meet their needs. But then what happens is, for the pursuer, that cool, calm, collected withdrawer suddenly is inaccessible, won't talk to them, is always playing computer games or, doing X, Y, or Z, and vice versa. This warm, loving, emotional kind of person is suddenly attacking and in my face and won't leave me alone, won't let me think, won't give me a chance to collect myself. So it's like the thing that draws you to the other person is also the double-sided coin, the thing that's going to make you the craziest. Learning through EFT that neither one of these are bad, but they're just different ways of being in the world, and being able to understand your partner Being able to look at your partner and say, are you anxious? Are you anxious right now? What's happening? And to kind of be available for them in a different way can be really helpful.
Yeah, this has been so helpful for me because my wife and I had this dance that we do, this back and forth of somebody would bring something up and then the other person gets offended and feels judged and then withdraws and feels like they can't be open and vulnerable. And it went both ways. And with EFT, the benefit was our therapist would help us look at this and say, the reason you care so much about this, again, is because you care so much about the relationship and because you love each other so much. And she helped us to see how, by understanding each other, we could get rid of that judgment side of things. So as I've come to understand my wife more and she's come to understand me more, instead of us bringing something up and then the other person being offended and then just closed off and doesn't want to communicate or talk or anything, we can sit down and say, oh, it looks like you're feeling this way. Is that right? Why do you think you feel that way? Was it something I said? Yeah, you said this. Oh, I'm sorry. Okay. So when I say this, it makes you feel this way. Well, I was saying that because I felt this way. And we explain it and we work it out. And that's where we've seen the real practical, tangible progress is that
exactly.
The things that our therapist had to help us work through very slowly and kind of like guide us through it. Now we're starting to be able to work through those things ourselves without the therapist there.
That's right. I mean, what we say in EFT, it's not that you're not going to have disconnection or disagreements with your partner. That's going to happen. That's life. But you'll be able to get through them more quickly. You'll be able to resolve them. You don't have to spend 2 weeks not talking to each other anymore. Once you've been in EFT, you don't have to sulk and all that business. You can find your way back into connection.
So I think we've become much more attuned, like you're saying, listening to your body. I feel like my wife and I have become much more attuned to recognizing when the connection's not there or when the connection is weaker.
Yeah.
And that's our therapist. That's how she starts every session. The first question is, how's your connection? And now we just ask that to ourselves all the time. We're like, how's our connection? Maybe just mentally in our heads, like, how's my connection with my wife? Or how's my connection with my husband? And when it's not there, we recognize that the connection's not there. We need to handle something. We need to talk. We need to discuss this. We need to work it out. And now we've got the tools that we can go and talk it out and work it out. And then we're coming to the end of it. We're like, wow, that's like a therapy session, but we didn't have to pay the therapist this time. This is great.
That's right. That's right.
So I've seen and read, that a lot of, or during COVID-19, it's been a very difficult time for marriages and for relationships for people to live together because we've been, there's been a lot of, for better or for worse, a lot more together time, a lot more, less getting out and going about. And so I think, I don't know the numbers, but I know statistically, divorce rates or, people splitting up, the rates of all of that are going up. So that's kind of just a little bit of a piece of information there to kind of lead into the question here, but getting into the solutions here and like the hope, how the strategies of hope that we can put into play in our marriages or in our relationships or, friendships and other, any important relationships to us and this, with all of this in mind, for anybody that's listening, which if you're in a relationship of any kind, you've experienced all of this, right? The highs and the lows. What are the tools, that obviously, as Josh said, it's very slow going, the process to really get in and do it. But what are some of the tools that people can employ, like, immediately in a relationship, or maybe some of the things to look out for, or some of the solutions to problems, on a day-to-day basis that can really help people start to break down some of these, barriers or some of these breakdowns in communication or connection and start to see their relationship thrive?
I think EFT makes it hard to answer that question because EFT is not sort of a tool-driven therapy. It's very experiential. You have these experiences in the therapist's office that you begin to integrate and into your repertoire of behaviors, and then you're able to use them with your partner. So it's different. That, I had one case, a couple started after COVID. that they'd never been to any kind of either one individual or couples work. But a lot of the people I see have seen a couple or more therapists before me.
Yeah.
Right. And the one thing they'll say to me is, this is different from anything else I've experienced. This doesn't go like most couples therapy goes. And that's because of the experiential nature of the therapy. You know, EFT does have a program, a weekend kind of program that I think they're still doing online. And I am just completely blocking on the name, but it's for couples who aren't necessarily in therapy, but who want a greater connection with each other. Josh, have you ever done it?
We haven't.
No.
I know there are like retreats and other programs and such, but we read the books and then we jumped straight into the therapy.
Yeah. So, I mean, I think that those are a way for people to have conversations, some difficult conversations about different topics that often are troubling in a relationship, that is less clinical, if you will, and more kind of relationship enhancement.
So like most things, it has to do with getting better at communicating. Like Josh is saying, it's a lot of that understanding how you feel and why, and how, you know, the other feels and why, kind of getting to the core there a little bit. It gives you that information to communicate more effectively in order to solve problems together and to get more to the.
Yeah. When you realize that your partner snapped at you, not because they hate you, but because, you know, they were feeling something else, and you begin to, like I say, your partner becomes more predictable to you. You understand under certain kinds of stress, your partner is going to become more anxious and more desirous of reassurance, or your partner under certain kinds of stress is going to, really withdraw and want more alone time. It's not that they're trying to get away from you, but it's that this is how they process often. So, you know, beginning to understand each other better. And like, I do think it's important that, like what you said, Josh, but it's without judgment, that we're not saying one of these is the better way to be and one of these is an inferior way to be. These are both ways to be in the world, and, you know, to give people the space to be who they are and to accept that.
Yeah, that's one of the things I've loved about the therapy sessions, is that our therapist will absolutely not let us talk about blame or guilt or whose fault it is. Like, and it's not just because she's trying to keep the peace. It's that just isn't part of EFT. That's not how it works. And it's not how it works because it's not reality. It really doesn't matter.
Right. It doesn't. I mean, I tell my couples, you know, you can do that without me, without paying me all this money to sit and watch you blame each other. You know, that's just not going to be helpful to us right here, right now. And that's what people do when they're feeling disconnected, is they're flailing around trying to figure out and understand. You know, we all develop theories about how the world works. And, you know, one of our theories might be, well, he must be on the spectrum, you know, and he doesn't have feelings, and that's why this has gone so bad. Right? Or she's really needy and just needs attention all the time. You know, people often come in with sort of typologies. They're this kind of person, and I just can't stand that kind of person. You know, kind of ignoring the fact that, you know, they married that kind of person. And what do you think? What do they think changed?
So, Dr. Bray, as we wrap things up, I've got just one more question. I mean, I've got 20 questions, but being sensitive to your time, I've got one more question I want to ask, which is, I think a lot of couples and people out there feel like they shouldn't go to therapy until they've got really big, serious problems to resolve. What's your response to people who hold that kind of opinion?
I would give anything to change it. I mean, I mentioned I started with a couple after COVID. We had met, we were all set up, getting ready to start. And their first appointment was like the day we closed our office because the governor had shut everything down. And it took them a while. At first they said, no, they didn't want to do the online stuff. And then they called and said, we need help. And they are a younger couple who hasn't waited too long, and they responded so well to the EFT model and really got much better. I mean, at this point, I'm seeing them kind of on a monthly basis because it's still COVID and it's hard right now, right? When people wait, and they've been married for 45 years, now we've got 45 years of history. And that's really hard to kind of muddle, to get through and take apart. So I think, the earlier the better. Plus with EFT or with any kind of therapy, I think of therapy as being kind of like your PPO, your doctor that you go see, preferred provider, right? You go see them throughout your life for different things. And
yeah, you have regular checkups and physicals and
having somebody that you can call up and access if things get really tough. One of my kids was a real challenge during adolescence, to have somebody I could rely on to kind of help me negotiate that. Even though I was a psychologist, it's my child, and I don't react like a psychologist to my child, right? I mean, I know a lot of stuff and I can use some of that, but my child's the most important child in the world. And so that's totally different.
Dr. Craig-Bray, it's awesome to meet you, and to talk to you and to get some of your wisdom. Again, anybody that's in any sort of relationship, whether it's a marriage or, other, these are things that they need to understand and know. So it's great.
Just to interrupt for a second. I mean, I've helped people, I've had somebody come in and talk about a sibling that they had a difficult relationship with. And it's often a pursuer withdrawer kind of relationship. And, so this dynamic, it also works with siblings. One of my children is a definite pursuer, and she and I would have kind of struggle. And once I presented this to her, and then it was like, oh, look at, it's made so much sense. So that particular dynamic is a dynamic that happens in relationships, not just marriages.
Yeah. And as you were talking, I was thinking about my kids. So, I've got 4 kids, and you can see they all come out a little different, and I'm younger, so I'm interested to see as they get into adolescence and stuff, what that looks like. But for our listeners out there, do you have any suggestions, one, for where they can learn more in order to, because they're all over the place, whether they're in the States or, outside of the US, where they can learn more, or how they might go about getting into therapy and finding a therapist to work with, one. And then 2, is there anywhere specifically that they can look for information from you, or do you have places that people can follow you to learn more? Or is there anything that you want to plug specifically on the subject or for yourself personally?
Just in general about the therapy, Sue Johnson has a number of YouTube videos. She's got a website where she kind of talks about the importance of attachment in relationships. She's her own best promoter when she talks about it. She's so clear. And we have 2 organizations, New England EFT, NEEFT, that you can look up, and they have a list of therapists who've been trained and who are certified. They also list those workshops that I was telling you about for couples, that, the enrichment kind of programs that I just can't even think of the name. And Seacoast EFT, which is the one I belong to, is another organization that lists couples who are certified in New Hampshire, Mass, and has listings for workshops as well.
We really appreciate the time. The other thing I would say is, when I was doing my initial research on this, when I did a search for EFT, it immediately popped up and Google said, can we know where your location is? Whatever, because I don't have location services turned on unless they ask. Clicked yes. And then it immediately showed therapists in the area that are EFT. I didn't look into it much further than that. But if anybody's interested in learning more or getting into therapy, to better the relationships, then just do a search for that and you can find it. Josh, did you have anything else before we wrap up with Dr. Craig-Bray?
No, I'm good. Thank you so much, Laura, for your time. Really appreciate this. It's been a great conversation.
Well, thank you for asking me. I appreciate it.
Yeah, thank you so much. Thank you, Laura.
Take care. Have a nice holiday, guys.
See you. Bye-bye.
You too. Thank you so much.
Hello, it's Corey here, and I just want to thank you so much for listening into the Hope Strategy Podcast. I hope you're enjoying it as much as we are enjoying having these amazing conversations with these incredible individuals talking about hope. We'd love it if you wouldn't mind liking, subscribing, and leaving us a review on iTunes or Spotify or anywhere that you listen to your podcasts, and share it with anybody you feel that can benefit from these messages of hope. Thank you so much for listening to the Hope Strategy Podcast.